COVID-19 cases and hospitalizations, we wanted to make sure North Carolinians have a clear picture of the viral spread in the state and what's driving it. So let's dive in. This first graph looks at people who come to the emergency department with COVID-like symptoms. This is our earliest detection mechanism, and you can see when looking at the yellow line that it's been trending up since the end of June. It's still below the blue line, which is where we were a year ago, but it's moving in the wrong direction. Next, we look at new cases. And this first graph shows you the trajectory of new cases each day since we had our first case back in March of 2020. The large peak you see happened in early January, before vaccines were widely available. But the area to look at today is at the right side of the slide, where we are starting to see that yellow line rapidly swing upwards. Today, as the governor said, we had more than 3,000 cases. The last time we had more than 3,000 cases in 24 hours was back in February. I want you to notice the slope of the yellow line, and you can see that this rise in cases is faster than what we have seen with past increases. This is because the COVID virus is now much, much more contagious than it was earlier. Let's zoom in to get a better sense of the rate of increase in the cases that have happened just in the last few weeks. On this graph, we're looking at cases from the end of May through today, and you can see a clear picture that our cases have increased rapidly. Here's another way to think about how things have changed so fast. The original COVID spread from one person to an average of 2 to 3 people. Now, the Delta variant spreads from one person to an average of 6 people. And nearly all of that spread is happening amongst people who are not vaccinated. Since early May, North Carolina cases are in 92% of people who are not fully vaccinated. Next, we look at the percent of tests that are positive. This graph also goes back to the end of May. And looking at the yellow line, our percent of positive tests is increasing rapidly and is now well above our threshold of 5%. On our next graph, we look at day-over-day hospitalizations. This graph also starts at the end of May, and you can see, looking at that yellow line and that steep slope up, that this trend has increased rapidly, and now we surpass 1,100 people in the hospital with COVID. This number has more than doubled in just 2 weeks and has been the fastest increase we've seen since the pandemic started. Like cases, nearly all hospitalizations are people who are not fully vaccinated. And while we're seeing increases in all age groups, admissions have increased by 200% for people ages 50 to 59 in the past week. Now, this next slide looks at what's happening at the local level. This map is from the CDC and shows the level of community viral transmission. Red is high, orange is substantial, yellow is moderate, and blue is low. And you can see that much of North Carolina is red and orange with high or substantial viral spread. We do not have any blue counties. This next slide shows why this moment is different from the last time we were experiencing rising trends. Vaccines are now widely available across the state. The highest rates of viral spread are happening in areas with low vaccination rates and among, again, those who are not fully vaccinated. As you can see, 55% of North Carolinians who can be vaccinated, those 12 and older, are fully vaccinated. And while we've made progress, that's still well below where we need to be to end this pandemic. Some counties are much lower. About 2/3 of counties in the state have less than half of their 12 and older population fully vaccinated. Bottom line, this is a moment of rapid viral spread driven by a highly contagious virus finding and infecting those who are still unvaccinated. If you haven't gotten vaccinated yet, I urge you to do so now to protect yourself and your community. Getting vaccinated prevents serious illness, hospitalization, and death, and it slows community spread of this virus. Rigorous clinical trials among thousands of people ages 12 and older have proven that vaccines are safe and effective. More than 160 million Americans have been safely vaccinated. Today, we're updating our guidance to respond to this current context. And our guidance is clear. If you are not vaccinated, you need to continue to practice the 3 Ws. Wear a mask in all indoor public settings. Wait 6 feet apart in all public settings and wash your hands often. In addition, if you're not vaccinated, you should not gather with unvaccinated people who you do not live with. If you do, please stay outside and keep 6 feet apart. Also, if you're not vaccinated, you also should not travel. There are also still places where everyone in the state still needs to wear a mask. Settings like healthcare and public transportation, large crowded indoor venues, and indoor places with a large number of children. The takeaway from all of this is there's only one way out of this pandemic, and that is vaccination. I am thankful to the numerous health systems that are leading the way and requiring vaccinations to protect their healthcare workers, their patients, and our communities and the state. We at the Department of Health and Human Services are following their lead and the recommendation of the nation's leading medical organizations, including the American Medical Association, the American Nurses Association. And DHHS will be requiring that all employees working at our state-operated healthcare facilities be fully vaccinated. And I want to thank the 76% of our staff members who already are fully vaccinated. This moment requires action. Our trends are accelerating at an alarmingly fast rate because of the highly contagious Delta variant. If you are already vaccinated, I call on you to urge your unvaccinated family and friends to get their shot now. It's not an understatement to say that you will save lives by doing so. Take a moment and listen to what doctors from across our state have to say about the urgency to get vaccinated right now.
We really are worried that this Delta variant is going to find everyone who's not protected.
The fact that this is more infectious, causing worse outcomes, and spreading like wildfire in the United States, I don't believe this is a wait-and-see period. It's a time to really roll those sleeves up and get those shots.
There are more people dying this week than there was last week. Our rates of hospitalizations are going up. The people that are losing their lives are the people that are unvaccinated.
And the good news we know is that the vaccines we have effective against this variant and against preventing serious infections in those who do get the Delta variant.
These vaccines are safe, they are effective, and they're necessary for us to try to get back to normal.
Look, you're rolling the dice, you're playing roulette with this, and the longer and longer you wait, the more and more likely that you are to get this and can suffer really severe consequences from it.
Everyone from teens to seniors can get a COVID-19 vaccine. Visit myspot.nc.gov.
Vaccinations are our way out of this pandemic. Don't wait to vaccinate. Thank you, Governor.
Thank you, Dr. Cohen, and the leadership of your team. This is discouraging. It's not the update we wanted to bring today. One thing I do know is that many vaccinated people are frustrated and mad. You've been doing your part, first with masks and distancing, and then with getting your shot. Thank you for stepping up to do the right thing for yourself and your community. I'd ask you to step up once more and channel that frustration toward pushing your unvaccinated family and friends to do the right thing and get the shot. You may be the most important messengers we have. Until more people get the vaccine, we'll continue living with the very real threat of a serious disease. We will continue to see more dangerous and contagious variants like the Delta variant. In North Carolina, we are issuing a new executive order and guidance aimed at slowing the spread among the unvaccinated and encouraging more people to get their shots. This order directs state government cabinet agencies to verify whether their employees are vaccinated. Unvaccinated employees will be tested at least once a week and required to wear a mask. We are strongly urging other state government agencies and private businesses to, at a minimum, do the same. Many businesses are going a step further and requiring their employees to get vaccinated, and I applaud that. We are at a crossroads in this pandemic, and we need the private sector to help us increase vaccine rates. Right now, being a good corporate citizen means getting your people vaccinated. Our economy depends on it, in addition to our health. And you know, this week, the CDC updated its guidance, and we are recommending people in North Carolina follow these health protocols. The first relates to schools. In accordance with the CDC, we recommend that all K through 12 schools require masks for all their students and teachers. And second, going forward, everyone in a county with high rates of virus spread, including those who have been vaccinated, is encouraged to wear a mask in public indoor settings like we are today. And for North Carolina, that's already 80% of our counties. So what's the bottom line here? It's simple. Get a vaccine now. It will protect you and prevent future variants like Delta that could emerge to threaten our health and the economic recovery. Do it for yourself. Do it for your family. Do it for kids under 12 who can't get a vaccine yet. Do it today. I know that hearing these messages is alarming. Everyone hoped we'd be past this by now, including me. But until more people get vaccinated, this is the reality we have to confront. And our state will continue to battle this pandemic by increasing our vaccination rates. That's the only sure way out of this thing. With me today is our Secretary of Public Safety.